probably going to take most of your time. Benefits eligibility, chart checking, so seeing if patients, in physical therapy, there's progress notes and things that occur based on number of visits. So every 12 visits, they have to do a progress note, which is like the PT sends a note to the specialist or to the provider, just an update. We either continue care. There's authorizations. That's a big part. Have you ever done authorizations or?
I've done authorizations. I used to be a massage therapist, so I'm very used to doing like soap notes and doctor's notes and all that. Yeah, gotta record that progress.
So the auths are more for just getting renewing approval for the treatments.
Some insurances have their own rules.
Which some you have to, again, document things. You have to read the note, put the things that the provider says. So that's a lot of the job. And then of course just being a receptionist at the front, being at the front, greeting, smiling, welcoming, talking to patients by name and just making them feel present and heard.
Welcome.
Team-wise here, we typically would have two. We have two patient administrators, which are kind of like the administrative front desk. And then we have two techs. So, but essentially it's the two at the front that are responsible. On a daily basis, I mean, the most that we'll see is like 60 something patients, but again, you have 5 providers, so it's kind of split up. Appointments are 45 minutes long, so they're not like everybody coming all at once, it's kind of spread out throughout the day. So it's realistically, in my opinion, it's not that compared to what I've worked in family medicine, I've worked in primary care, definitely more complicated. Physical therapy, it's a little bit more easy. The most difficult thing I think is this, because it's just having to physically call. I mean, availability, you can get some of that information, but you can't get it all. So.
Yeah, I'm used to being on hold half of my shift, just talking to 5 different insurance companies.
So that's
verifications, calling other clinics, trying to, if something's not in the file, you have to call and get that faxed over.
So that is a big part of it. Is it something that I don't think you would do well? I think you'd be fine. I think you have the experience. You've done different roles, and you've obviously dealt with a lot of insurances. So that's a big part of it. And communication, you're a good talker. So
yeah,
I'm sure you'd be great with the patients and talking to them and greeting them. But yeah, I think that's really from my end. So the process that we're doing right now is we are exploring. You did kind of reach out to us. Which that's why I wanted to meet with you until we have like a solid open.
Okay.
At least for our clinic here. Doesn't mean that the Anchorage team. We have the clinic here and then we have the clinic in Anchorage, but then at that point, I don't think you would want to.
Not come the winter, yeah. But I'll check back in and if
I will definitely let you know, and I'll keep you in the loop. Again, we should have an answer here soon.
Okay.
And by soon, meaning within the next week, couple of days. And if we do have an opening, then you would definitely be a strong candidate. But we have to have a for sure space. Can't just make a space.
Yeah, a lot of the clinics around here are expanding, and some of them are hiring, some are we're not sure.
Yeah.
But I don't
There's
mind
definitely
meeting and.
There's definitely a lot of good opportunities. So I'm always. Of course, you're always
slow.
in the loop to see, but you got to find something that is close and.
It is a little slow right now, but I've been told once you hit December 1st, a lot of people are going to be moving around, and there's a lot of growth potential. So if not now, then at least in the next 6 weeks.
Yeah.
Yeah.
But I do appreciate you coming in, and I do think, like I said, I think that you'd be a good candidate. You would definitely do a good job. And the way that we would bring it on is, we would want a full-time. Our hours are typically from 7 to 6, but it would be more of the evening shift that we're seeking.
I like that.
So it would be the 9 to close.
9, is
Nine.
it